Mark, I'd like to ask you a little bit more specifically about the role of the Gates Foundation during the pandemic and also looking ahead towards another one. So if you look back over the past 3 years, I love your what went right question. I also want to ask you about a what you would do differently question. So looking back, choose the thing that went really well over the past 3 years, and also tell me, when you're looking ahead, what you would be sure to do differently if and when a new pandemic hits us.
Well, I fear it is going to be when rather than if. So we should come back to that because you had that. And I think the world is not taking the action that we need to be ready for that next pandemic. But when we look at the last one, what really went right, going back to, is the vaccines. People don't understand how unprecedented it was to get the vaccines so successfully so early. We work on vaccines in many other areas. We've been working for vaccines in malaria, for example, which is a scourge that affects tens of millions of people every year and kills hundreds of thousands of children, millions of children over many years. And current vaccines have efficacy rates of 30 to 40%. The COVID vaccines ended up having efficacy rates of 80, 90%, the mRNA ones. That is really, really unusual. And to be able to get that early and to get it with new technologies like mRNA, which is a technology we were very early investors in at the Gates Foundation, but at a time nobody thought it was going to work. They thought that was a pipe dream. We invested in it because most people were looking at it as potential cancer treatment, and we thought perhaps it could be useful for TB or malaria, and we still think now it may be. But that's amazing, and it has brought powerful lessons for the future. The mRNA technology itself, how you think about the world of vaccine infrastructure, that's the big positive. The negative was the distribution, that it was not equitably distributed. Once these vaccines came online, the reality was there was a bit of a chase, particularly by wealthy countries, that locked up most of the available supply. There were good efforts, including those supported by the United States and others, like the COVAX initiative, that were intended to try and alleviate that and provide vaccines to the most at-risk populations in developing countries at the same time. But the truth is, in a supply-constrained environment, that failed, at least in the early parts of 2021, which is when the vaccine rollout was happening. Now, over time, we got that right. COVAX ended up distributing over 2 billion doses of vaccines in 146 countries. But the delays meant that many highly at-risk people did not get vaccines at a time their lives might have been saved, when many, many low-risk people in wealthier countries got vaccines. And so putting in place a structure and a system up front that allows both countries to put in place broader public health emergency authorities, and I'm happy to come back to that. It goes back to your first question. But then specifically on the equitable manufacturing at scale and then distribution of vaccines and or treatments, because actually in future pandemics, we might get therapeutics, which are treatments more rapidly than we get a vaccine. We were very lucky on the vaccine in COVID.